So what's the point of the Queendom? What are we here for? What I want to do is to empower the next generation. And the best way to do that is to start by new life. If we're able to talk into, to bring up, and to strengthen, and to give the best to new life, then we're able to create a new world. Well, how are we going to talk into new life? The cradle of new life is the woman. The woman is able to hold, to feel, to speak into, to nurture and create a whole new world through one little person. You see, if the child is able to have a good nutrition, they have the best start. If a child is able to have a strong mental capacity, the world will definitely benefit, because a strong mind is what anyone needs to start off a new world. If a child is able to have all that they need at the beginning of their life, it will definitely reflect in the end. And so we want to hold hands and take the woman and empower her. We want to give her as much information as we can. And that means coming together with doctors, with lawyers, with financiers, with anybody that will help this woman make informed decisions for herself, for her family, and for the next generation. Now that is what the Queendom is about. Walk with me and let's do this together. Let us bring up the best generation in the next generation. Thank you so much for joining us, and I pray that I leave a mark in your life. Yours truly, Kezia. Karibuni, everyone. Sorry, my daughter's here. Just a second. Motherhood calls for so many things and balancing all these different elements. But I'm just happy to have everyone here with us. Karibuni, karibuni to another lovely session. We've taken 15 minutes of intro. One day we shall come to a place where we don't have to wait for people to join us. So Karibu Kezia, listening in from Garden City. I just want to welcome everyone. I want you guys to share with me the chat. Just write to me where you are. Where are you located? Just tell me, just write down and say, I'm listening in from here, so that we can get to know that you guys are there, you guys are listening and you're active, and my sound is working and my video is working. And I'm just so happy that everyone's on time. That's another thing I want to commend you for. It was just 15 minutes, my baby's crying and the other one's doing I don't know what. But I'm just happy to have everyone here. So karibuni sana to a super episode of Pain. There, the comments are coming in. So Pauline is listening in from, Pauline, are you listening in from Garden Estate? Harare, Zimbabwe, that's a big one, wow. We have some people from Westland. I'm just happy to have everyone here. I'm glad you guys can hear me. Yeah, and today is a big episode, okay? Because pain is a real part of the journey. You can't go through motherhood without pain. And I'm seeing all your comments coming in, by the way, so just keep them coming in so that I know you guys are active and you're listening. But yes, we're going to dive into pain. We're going to, try and understand what's going on. And I think we're going to take this in a 3-part series. So we won't really do everything today. because pain is a big topic. Sorry, let me just adjust my camera. But I want us to really take a look at aspects and elements of pain from the first angle, and then we'll go into the second one next week, and then the third one the week after. So karibuni sana. Please remember to be here every Wednesday at 7 p.m. So at 7 p.m., whatever you're doing, do it fast. Okay, if you're driving, drive. Okay, not too fast, but just make sure you're on the way. And try and give me some time at 7 p.m. We struggle to get that time, but now that everyone's joining in, I can see me touching my screen here. It's because I'm trying to admit people, but I'm just happy that you guys are all here. We're also joined by a surprise guest who's not quite a surprise. Some of you are actually here because he's here, and I just want to welcome him. But before we welcome him, before you jump in, I wanted us to walk through this journey into motherhood. So let's take from the 30 days, from just before, when you're still counting the months and you're still round as a button and you're still, in the flowery, dealing with nausea and heartburn, and the full 360 curve. And you start to feel pressure, almost like pelvic pressure, like you feel the pain down in your pelvis and it gets uncomfortable. And I feel like that for me is that's the start, that's the kickstart of all the pain. So at that point, you start to understand where your pelvis really is, what's going on in your pelvis, and what, these different senses of pain. And at that point, you're also able to identify, like, this is not my leg, this is actually my pain, my pelvis. There's also back pain that catches people. You get nerve pain at that point, Braxton Hicks, the full shebang. And so that leads into delivery, and that's where you go the full 9 yards. In delivery, I do want to stress that I feel like the women in Kenya don't really know or understand pain and pain management. Hi, Jerry. You guys are still writing in. Thank you so much for joining us. If you've just come in, we've just started, and we're talking about pain, and we're just saying that we don't really expand and understand the threshold of pain and what we can do, to manage our pain. And we don't even know that there are management solutions and the management options to pain. So let me first bring that out. Yes, you have solutions and options for pain. Remember, pregnancy and maternity always end in a little bit of pain. So childbirth is a painful process. It's the curse that we were given. But there are ways to manage this pain. There are ways to go about, the process of pain. And maybe at this point, let me just introduce a couple that I know off the top of my head. I do want to repeat my disclaimer. Nothing here I've shared should be taken, as the way I've said it. Please go back and talk to your professionals, your doctors, your pediatrics, and your gynae, OBGYN and pediatrics, just to confirm everything I'm saying. But from what the information that I've gathered, pain, actually, you have two methods of managing your delivery pain. You have your natural and let me say non-medicinal pain options. So these are like, the ones we know: breathing, being in a comfortable space, being in a comfortable room, ensuring that, you're relaxed. There's high hypnosis, there's music. For many of you who know me here, I danced my way through my first pregnancy. I just put the music on loud. I'm so sorry if anyone from Aga Khan is here. They must have gone mad. I literally put the music to 100 because that's what helps me manage pain. So you could use things like music, things that distract you from, the actual pressure. And I mean, it worked. So these options actually do work. The other ways to manage your pain are actually medicinal and, your typical hospital medicinal methods. And these include, there are three major ones. Now, I'm going to call the doctor on standby because I hope I'm getting them right. But the first one is laughing gas, which it sounds funny that you call it laughing gas. But it didn't quite make me laugh. But it did help me manage my pain. So I was able to take in the gas. By the way, disclaimer, I'm not sure, but I believe most hospitals offer this gas, which is, gosh, I'm trying to get the medical name. It starts with an M. I don't know if you remember. If you know this medical name, please put it in the chat box so that you help me out, because I can't really remember the name. But this laughing gas is available to every patient, every mother who's coming in to deliver. And they do have it on standby. So if you need it, they give you this solution. The second one, I'm going to have to write it down later because I can't remember what it's called. Guys, I just had a baby, so I have mommy brain. But I do know the third one, which is epidural, which is available. Nitrogen oxide. Janet, thank you so much. It's called nitrogen oxide. Yes, that is a gas that is available for us to us in hospitals. The third option is the epidural, which the doctor will take us through as we go along. But at this point, maybe I could talk. No, before I get him in, I also do want, I stopped at delivery. Sorry, I wanted to go past delivery because yes, after the event, after you have your baby, you do have postpartum pain, post-delivery pain. And these pains actually linger on a little longer. Sometimes we think it's normal to have pain. So you'd find a mother maybe breastfeeding in pain and she's just comfortable with it, or she just, tries to, she breastfeeds through the pain. Or pains that are actually adopted. So you'd breastfeed and with maybe a bad position and you just keep going and it actually causes more harm. So today I wanted to take a look at what the doctor has to say. I think he's a doctor, but he says he's not. So maybe, Mihir, are you here with us?
Hi, good evening. How are you?
Good, how are you?
Good. Thank you for having me. It's a great honor to be here, and hopefully I can answer a few questions that your audience has.
Correct. Thank you so much for coming in. I'm so happy to have you here because it's good for us to talk to someone who knows exactly what this is. That's the reason why I feel like you're a doctor. I actually asked some of my people to ask you whether you are a doctor. I feel like doctor should go before the titles, but you are dealing with actual natural remedies and medicines. So tell us what you do. Let me not go ahead of myself.
So correctly, I'm not a doctor, and I think the title carries way too much pressure. So let's just stick to Mihir for now. So I'm an osteopath, and in a very simple terms, I'm a manual therapist who looks to ease pain through using my hands, through soft tissue massage, manipulations, stretching, exercise, and occasionally give some kind of advice based on nutrition and postural kind of help. A lot of people will say it's an alternative medicine or alternative treatment. However, I believe that's not the case. I believe it's complementary to what we call the allopathic medicine. So I've been practicing osteopathy as a fully qualified osteopath for the last 8 years. And I would say as a training osteopath, I've been working for the last 11 years.
Wow.
Yes.
It's very, from just a mom, it's very difficult to know when to call you. So tell me, when do I find you? At what point in my journey, like say for example, I get pregnant, do I just kick off and come to you after the hospital, or at what point? Because I realize most of the methods that you're using are actually, how can I say, you pain. I need to know to avoid maybe using exercises. I don't know. So I need you to tell me, when can I come to you?
So honestly, there's no guideline. You can come after you've conceived and you're pregnant. You can come pre-conception. You can come postpartum. Actually, there's no right or wrong time to come and see a manual therapist, to see an osteopath.
Okay.
Back in the day, we had wise parents, grandparents, and they always used to say prevention is better than cure. it still stands true to today. Why should you wait to get some pain to seek help? And I think with social media, with the current education system and awareness, a lot of people are now more aware of complementary treatments available to help through their journey. Unfortunately, pregnancy has a lot of negative stigma associated with it. Or if I get pregnant, I'll suffer back pain, I'll have this, I'll have heartburn, I'll have incontinence and all that. And a lot of negativity is put in that. And yes, some people do suffer all those, but if they are undergoing good treatment plans and they have a good setup, they can minimize the effects of that and potentially have a very simple, pain-free pregnancy.
Right.
And there's another thing that I constantly hear from lots of clients. Oh, I've had back pain for the last 10 years. If I get pregnant, will I be able to survive the pregnancy? Can I get pregnant? I've been told if I get pregnant, I'm only supposed to be in bed because I've had a history of back pain.
Correct,
Unfortunately, this is all misinformation, misleading. Just because somebody has had back pain in the past does not mean they'll have back pain during pregnancy or post-pregnancy. So it just depends. And I think the biggest thing is the fear. We as manual therapists, as complementary medical practitioners, you want to instill confidence in upcoming mothers and slightly different in general, the general population. We do not want to instill fear. Fear is the biggest kryptonite.
Correct.
So I think, unfortunately, doctors have not been the best at communicating certain aspects of health, and the fear has come in from that.
Okay. I think the medical fraternity these days prefer to deal with the situation at hand. And so it would be a symptomatic kind of treatment. But actually, I'll tell you something interesting. I bumped into a doula who saved my life. She was a midwife, and she, taught me a lot of things that I needed to know beforehand on understanding pain. And the one I'll share with the audience is that there is a fear, tension, pain cycle. And so what happens is, if you lack information or you're not too sure of what's going on, you'd get tense, right? So you'd be I'm not too sure, I don't know how to do this. And that creates, it actually undoes the process. You're actually aiding more pain. So your body is unable to relax, your muscles are unable to relax. And when you do that, you actually cause pain, which kicks you off to the beginning. And so I didn't know that. If I'm a mom and I'm going into, labor and I know, I'm 39 weeks or whatever, I would go into labor completely clueless. I haven't gotten much information about any pain or anything from my doctor. And then when I go into labor, suddenly I get into total shock. I have no idea what to do. And I didn't even know that I could use maybe epidural, or I have no idea what's going on. So maybe for me to share that through the process of especially childbirth, there's a lot of professionals that are in between that help the process so that it becomes easier. We've just hosted the other day a fitness instructor who will actually help you, be able to take in oxygen and to do more exercise, so that when you get to that space, you're not dealing with pain at a totally blank slate. You kind of have, a bit of information in the background. So I think that's what I'm getting you here for. I just want you to tell us what exactly your profession entails, what you do within motherhood and even without, in terms of sports and, injury and what have you. And at that point, what would make me come to you? Because I also used to think that only old people go to see you. I don't know where I got that mentality, because through the years, you learn to deal with more specialists. But the truth is, the younger guys should also be able to come to you, especially when they're dealing with soft tissue injuries, or trauma, in that kind of statement. So I don't know if you can walk us through, your profession.
Okay, that's fine. So what I'll do is I'll speak specifically for the duration of pregnancy from week 0 to week 40 as a starting point. And then if there are any questions in between at that time, please do feel free to either put it on the chat and I'll try to go through it, or if they want to ask a question, they can just speak up. So as you go through 40 weeks of pregnancy, the first trimester, I think, is 3 months. And this is the time where things can potentially, it's dicey, because you don't know if you're going to, it's a critical time, because this is where most miscarriages happen, most complications start. So the first 3 months, I think generally one has to be fairly cautious in their physical activity,
right.
in their health, and just management of that first 3 months. However, that does not mean that one just bed rests. I hate the phrase bed rest, and I'm getting personal here, but I hate the phrase bed rest, because that's the number one way to destroy your health in any kind of situation. Yes, there's a time for rest and there's a time for activity, but this idea of bed rest, okay, for the first 3 months, I'm just supposed to be in bed, not doing anything, I disagree. There are certain exceptions to that, of course, but as a general, I have no issues with somebody doing kind of exercise or anything. So first three, sorry, I think there's somebody trying to ask a question.
Okay, please go on.
Sorry. So going back to the first 3 months, I would encourage walking every I would encourage everyone to walk at least for an hour a day. Gentle yoga, so gentle stretching of the whole body. And if they have access to a swimming pool, swimming is perfectly safe. And then as you get through your pregnancy, your body will change. You'll get something called a hyperlordosis. So in your lower back, you get that inward curve, which will become more and more exaggerated because your belly is growing. So in order to allow you to walk comfortably, and your body will change, and you'll almost come out with the sticking out belly. So your upper back becomes fairly tight, your lower back becomes irritable, your hips start to open up and become tight because it's trying to support the additional weight. And then you start getting complications of heartburn, swelling of ankles and feet, which is all managed well with manual therapy. So people will come to me for regular manipulations of the spine to maintain good spinal flexibility. They'll come in just to deal with kind of tension headaches because the posture has changed. So there's a lot of pressure in the neck and head. So they get a lot of headaches. So they come for that. So throughout the pregnancy, what the osteopath will try to do is to help allow the human, the mother, to adapt to the changes which are happening due to physical changes.
Right.
When you start pregnancy, you weigh, let's say, 40 kgs.
Right.
And then your weight will go up because you're now carrying another human inside you, and they will grow at an alarming rate, and they will actually deplete you of your nutrition, your energy and all that. So your body fatigues very quickly. So seeing a manual therapy for massages, for manipulations, will just help the body function more efficiently, help the circulation, so that the aches and pains don't come on that often, and you have more energy because your circulation system is working better. And then, of course, making sure your diet is on point so that you're able to sustain 2 life forms as opposed to just the one.
Right. So at this point, I was just trying to figure out, like, how much pain should I be taking before I come to you? So if you're saying headache, how do I know I'm not just drinking enough water and I need to come? I mean, is it at a critical point, or at what point? How do I know how critical the pain should be?
I don't know why one should live with pain during pregnancy. I know everyone knows but it's normal to be in pain when you have pregnancy. In my experience, if you have any kinds of pains, you can always call the therapist. So in this case, you can always call me and ask, okay, look, I'm suffering from headaches. What do you suggest? And then we can go through a few questions and find out whether it's just dehydration, as you've mentioned, or is it something physical causing the headaches. And there's no harm in going, even if there's no pain. So, example, you decide that so let's say you're 4 months pregnant, and you're feeling fine, but you just want to come in for a checkup. That's perfectly fine, and a lot of people do that. So when I was working in the UK, a lot of people did come, even when they were not in pain, just to make sure that their bodies are ready to adapt to the change. They come in for just general checkup, just for an adjustment. So yeah, why not? Pain is not normal. Pain is telling you there's something abnormal happening in your body. Yes, pregnancy will cause pain because the body is changing. However, you can, when the pain comes, you can adapt and change so that you're not in pain. Does that make sense?
Correct. Yes, that does make sense.
So going back to your first
pregnancy, sorry.
So going back to your first question, when do I know if this pain is normal or not? Pain is not normal. Pain is telling your body, hang on, there's something that is overloading my system. I need help. Go seek help.
Okay. I'm telling you, when you're going through pregnancy, half the time you're like, what was that? And you're just dealing with, wow, or is this nausea, or is this pain? So when you go to the hospital, what the word they use the most is discomfort versus pain. So now you have to now plate. Okay, this is now not pain. This is now discomfort. Like, it's very hard to know the difference, especially when your mind is elsewhere. Say you're working or whatever, you just know that I'm just not comfortable. I can't tell whether this is pressing on my nerve or I can't walk. I need to. By the way, guys, if you have any questions, please write them in. I have a couple of questions coming through, so we're just going to attack those as we move. But if you do have questions, please write them, put them down in the chat, so that we're able to attack these.
So one of the things I've learned, Kezia, from my experiences, a lot of these aches and discomforts generally happen because the individual is not active. They're not listening to the body, and they're not trying to figure out what's going on. I think they ignore it, and I feel that if a person's active throughout pregnancy, and when I mean active, doing regular stretching, breathing exercises, working out, whether that's through yoga or through walking or through weight training, they will realize, okay, this is a discomfort because I've just overworked myself versus, I've injured myself, I'm in pain, I need help. And I think mothers don't give themselves enough credit. Young moms, pregnant women don't give themselves enough credit. I think they go by the book too much, and a book is just a guideline. I think they don't trust their intuition. They don't trust themselves for whatever reason. Right. And it's natural as well, because you hear all these stories about, this happened. I think one of the biggest things I will always tell my clients, trust yourself. You're a mother.
Yeah.
You know what's normal versus what's not if you listen to yourself. Yeah. A lot of mothers don't give themselves the care they need themselves. They're always running around trying to figure things out, doing other things, and not giving themselves enough opportunity to just look after themselves. So going back to that discomfort versus ache, I think if you just take a moment, take a step back, and just try to visualize what you're experiencing and see how that relates to the last 2 days you've had, you'll be able to say, okay, you know what, this is more of a ache that I need to get resolved versus, I've just overworked myself, I just need to take a day's break. And a lot of times, a lot of these aches and pains that pregnant women get, once they sleep it off at night comfortably, the next day they're fine. It's the ones that last for more than 2-3 days is when I think they need a bit of help.
Yeah, that was heavy for me. Women need to learn to take care of themselves. It could be simply just the amount of water you're taking, or just eating a healthy meal, or just taking out a couple of hours in your work, in your office, to go down the stairs and come up. Maybe you've sat the whole day. Those little things matter so much, guys. I hope you guys are listening, because the message we're trying to preach now is self-love for moms. Guys, take a shower, stop. It takes so much for you to love yourself, but it's your body is craving for it, demanding for it. In fact, we're talking about pregnancy, but post-pregnancy is now a must, because the amount of things you're doing, the amount of weight you're carrying, the amount of milk that you're producing, you need to take care of yourself. It's very, very important.
And one other thing that I want to mention, throughout your pregnancy, your hormonal cycle changes drastically.
Wow.
Your chemistry, your internal chemistry is trying to figure out different things. So you're going to have mood swings. You're going to have energy fluctuations. You're going to have all these kind of moments where you're feeling hot, cold, sweaty, all that kind of stuff. And listen to it. When you're feeling that, just take a moment, take a breather. And it's okay to just ask for help. Yeah. There's nothing wrong in asking for help. Mothers do everything. They'll turn the world upside down for their kid. But when it comes to themselves, they'll neglect themselves. So please, my humble request to all you mothers out there, please look after yourself like you look after the world.
Wow. And that's it for our evening session. No, but that was the most powerful line, guys. I think that's the take home. Take care of yourself. Because if Mihir here, he's in the field and he's actually telling you that the real issue is that you're not managing yourself, it's a really big deal, guys. So there's a question I got here from someone, I've lost the question. But there we go. From Manuela is asking about, speaking of diet and weight, how possible is it for an overweight pregnant woman to lose weight up until the end of the second trimester? Is it advisable?
Weight loss. I think there's a danger that there are two ways to go about this, in my view, and both are dangerous. We live in a world where body shaming is quite bad, and it's actually horrible. And people look down on certain images. So when mothers are expecting, a lot of them will end up binge eating because they want to indulge. And maybe that's because pre-pregnancy, they were always shy of eating because of this image of their weight and their figure and all that. So maybe that's passing on, I'm not sure. And then they end up putting excessive weight on during the pregnancy, which is not the best. However, one should not try to lose weight during pregnancy. I think that would be dangerous, because in order to lose weight, you're doing a calorie deficit program effectively. You're feeding two people. You're actually growing a fetus inside you. So the last thing you want to do is do a calorific deficit, because that's dangerous. So in terms of losing weight over pregnancy, don't do it consciously. And if you're eating well and exercising, you may end up losing weight, but that's just because your body is reacting positively to it, as opposed to you reducing your intake of food. So, and that's why I think exercising through pregnancy and eating well is important, so that you maintain your normal weight as opposed to putting on excessive weight. And I would strongly discourage somebody trying to lose weight during pregnancy. I would strongly discourage it. But that does not mean one has the freedom to eat all sorts of foods, because that's not good either.
Yeah.
So it's slightly beyond my scope of practice in terms of advising for nutrition, but in very simple terms, eat well, exercise, and look after yourself again.
Yeah. And also, let me just add, I feel like it's difficult for me to talk, especially with things to do with weight, because I'm not necessarily, my BMI is pretty small, but I truly believe that it's because you don't understand what you're doing. You're creating a human being. I think it's the biggest creation that, life would have. Give yourself that grace. We spoke last week on weight and understanding really what's happening in society and body shaming and all these things. And I just feel like mothers don't give themselves grace. God created this system to work perfectly until the end. And a lot of times you'd find actually that breastfeeding is like going to the gym. If you just take the blows as they come and just go through the journey right until the end, then you'll start looking at, what you could have or could have not done. I see pregnant women in waist trainer, and it shocks me because I don't think we've educated enough to the level where we need to know that you're doing the biggest job in the world. So give yourself that grace, understand that you're creating a human being, and just go through that process. Soon through we'll get a nutritionist to come and talk to us about actual diet and health, so that we're able to delve more into this. Mihir, you have something to say?
I think for every mother, when you're going through pregnancy, don't compare yourself with another person. Right. Someone's body type, genetic makeup will be very different to another person. So yes, two sisters can be pregnant at the same time and one puts on 10 kilos versus 5 kilos.
Yeah.
That's not because one hasn't looked after themselves versus the other. It's just a genetic makeup.
Correct.
As long as you're eating well, exercising, it doesn't matter. That's true. There's a saying I say that somebody looking skinny does not mean they're healthy. They could be internally obese.
Yeah.
Versus somebody who's a bit fatter, yet they exercise, eat well, and move well.
Yeah.
I know what I would want. I want somebody who can move well, who eats well, and has lots of energy, versus somebody who looks like the perfect model. I would rather not have that. So for every mother, please look after yourself, eat well, exercise. Again, I'm repeating myself, but I think that's the biggest thing I can say.
Yeah. Let's just take on another question here. What kind of pain does osteopathy help to relieve during pregnancy? I think we had kind of taken a look at that, but what kind of pain?
Pelvic pain is quite common in pregnancy, where the pubic bone, what they call the pelvic pain syndrome, the coccydynia kind of pain, all those kind of lower back pain, pelvic floor area kind of pain is very common. Sciatica is very common. Yeah, so those kind of pains we do help with. And what does treatment entail? Again, it just depends on what I see when I assess the expectant mother. It could be anything from acupuncture to manipulation to soft tissue massage. It could be just simply giving them a nice stretch to do every so often. So somebody with pelvic pain, sometimes using a donut cushion is all that they need. So again, each case will be very different, but sciatica is another common kind of pain that mothers get. And again, that's purely because of how the body is adapted to carrying the fetus. So there's going to be added pressure on the lower back. The hips become tighter, so the sciatic nerve again gets irritated. So when that happens, coming to an osteopath, we can help loosen that, release that, stretch it out, improve your flexibility so your body has a bit more buffer zone to kind of play around with and expand into, or kind of relieving pressure in other parts of the joint. So yes, I think that's some of the most common presentations I get during pregnancy.
So that probably leads me to my next question. She asked, how does this work in one session, or is it a continuous process throughout the pregnancy and delivery?
Again, it just depends individual to individual. In my experience, if they do get back pain during pregnancy, they generally come once a month just to help out. Sometimes they need more frequent treatment. Sometimes 2 sessions is enough. So again, it just depends on each case and each individual.
I have another question here. Is osteopathy safe for all stages of pregnancy? And how soon after giving birth can I come back and get back into it?
So yes, osteopathy is safe throughout pregnancy from week 1 to week 40. And in terms of how soon can you see an osteopath after delivery? Again, whenever you're ready. There's no time frame. The only thing that I will mention is if you've had a C-section, I may not work directly on that for 6 weeks, but I can work on other parts of the body. So we're going back to how quickly can one see an osteopath after pregnancy? The answer is straight away, but what they treat and how they go about it will be dependent on different factors as well. Somebody who's had a C-section, the osteopath will be fairly careful on how they work around the scar and the tissue, because you can't be too aggressive on it because the healing won't happen properly. However, if you don't address it as well, you end up forming too many scar tissues. So there's a fine balance between the two. I think I've answered that question.
Yes,
and
you have. So we
what
have
was the other question?
Is arthritis related to I had read it. Is arthritis related with osteopathy?
Yes, it is. We see a lot of cases of arthritis, and arthritis can be of many different kinds. Just out of interest, there are over 100 different kinds of arthritis that exist in this world.
Wow, I didn't know that.
And the two most common are osteoarthritis, which is wear and tear, which happens as we age, and the other is rheumatoid arthritis, which is an autoimmune condition. And osteopathy will help with any of those kind of arthritis situations by giving exercise, strengthening of the muscles, mobilization of the joints, drainage to reduce the swelling. So yes, arthritis and osteopathy do go hand in hand quite a lot.
That's an interesting fact. I think I didn't know that. Is it something that would affect a younger person, or is that an age-related illness?
Again, it's two things. So osteoarthritis is generally affecting the elderly population. Okay. However, rheumatoid arthritis affects younger people. It's an autoimmune condition. So I'll give you an example. Rheumatoid arthritis happens more commonly in ages between 18 to 35. So again, I think there's a misconception when people say, "Oh, how can you have arthritis at such a young age? How can you have pain at such a young age? What will happen to you when you get older?" I think people have to be very careful on how they comment on such things, because it can be very damaging to the person's psyche.
Yes.
And now it's not your fault you've got an autoimmune condition. Now, if you've been infected by a viral disease that causes you to have rheumatoid arthritis, how is that your fault?
Yeah.
So again, just being very careful of how we deal with people, how we interact and talk to people. Pain is a serious matter. Let's be empathetic towards them and understand how we can help them.
Yeah. I'm trying to understand if what you deal with is it on the muscle, or is it any pain whatsoever, including cuts and bruises, including anything that would not be
a lot of pain, a lot of different kinds of pains, nerve pain, joint pain, injuries through road traffic accidents. When you mention cuts and bruises, that's more emergency and accident where they need to be stitched up and all that I don't do. But yeah, whiplash is another kind of condition that we treat quite a lot with. Sciatic pain, trigeminal neuralgia, facial pain, headaches. Those are kind of things we see. So yes, it's bone related. Yes, it's muscle related. Yes, it's nerve related. It's everything.
Right. I have a question here from Joy, and she says, on postpartum pain, I had a 4th degree tear, and sometimes I feel some pain for a few seconds. The doctor says I'm fully healed. Could this be psychological?
Okay, I'm sorry, Joy, that you went through that. I can imagine that must have been a very painful experience. Again, going back to scar tissue and formation. Yes, you may have fully healed in terms of your tear, but the scar tissue may be the ones causing you pain.
Yeah.
So with this one, Joy, I'd rather speak to you privately because I know where you're going with this, and I don't want to announce it or discuss it in public. But there are ways to go about resolving this pain, and it could be psychological. I'm not saying it is, or it could actually be a physical issue that needs to be resolved.
Yeah. Yeah, this is actually where we're talking about trauma and post-trauma. We're going to share his contact on the platform, so don't worry, I'll get you guys in touch. But if you actually need to see him, let me know, and we'll swing you by his way. I wanted to talk about back pain because it's just common. I think it's probably, I don't even know. I think everyone has back pain. I don't know to say that, but postpartum, your back is really a mess. And then I realized slowly that no matter how many cushions I'm putting and like how many like designed like shape type pillows, I still end up with back pain. There was a time in my first pregnancy after the back pain, I realized that my calcium levels were low. I started taking the calcium and poof, it disappeared. But back pain for me is a really adamant, really nagging pain that just exists. In fact, to be honest with you, a lot of women just deal with it. Like, oh, ngongo yangu, and they just move on. But it shouldn't be there. We shouldn't be having back pain. Is that correct?
So back pain, I'm not sure of the exact statistics, but I think between 80 and 90% of the world's population will experience back pain at some stage in their life. I'll give you another statistic. In Europe, in Great Britain itself, the NHS, which is the National Health Service, they spend approximately £3 billion. So in Kenya shillings, let me just do a quick math. Quite a big amount is spent on treating back pain.
Yeah.
And when I mean by treating back pain is £3 billion worth of revenue is lost because people have taken days off for back pain. This is registered back pain. Incompetent treatment of back pain by giving just paracetamol, brufen. So the UK economy loses 3 billion sterling pounds a year on back pain. Yeah. So to put that in perspective, that's a lot of people suffering from back pain.
That's right.
Back pain will happen at some stage in life. And the best way to treat back pain is through good exercise, good movement, and posture.
Right.
Postpartum, a lot of mothers will suffer from back pain because, number one, they've lost a whole kind of 5-10 kilos worth of weight overnight because when the baby comes out, they do that. And then the hormonal system is also changing. So there's a lot of ligament laxity because oxytocin was really high during pregnancy, when labor in specific, and oxytocin actually relaxes the ligaments and the tendons around the joints.
Yeah.
So what happens is the ligaments and tendons that were supporting the joints all of a sudden lose their integrity. So now all the force is bone on bone. So you get back pain.
Wow.
So it's very important, especially from the moment you give birth and 6 weeks, that you rest well and you do gentle, safe exercise so that your body can heal safely without putting too much stress on it. And mothers, again, they will do anything to make sure the baby is comfortable. So they'll sleep in weird and wonderful positions which they would not do otherwise. They'll sit in weird positions to make sure that the baby is comfortable. They're feeding. So a lot of it is postural again. You'll end up slouching, and as my wife is just sitting here, she just stood up nicely because she heard about posture. Think about it. Ligaments and tendons have become lax, so your joints are now supporting each other. Now you slouch like this. You're going to be putting pressure on the capsule, joint capsule, on the nerves. Of course, you're going to get back pain. So it's normal, but through good exercise, good stretching, and looking after yourself, will minimize the severity of back pain postpartum. Yeah, Kezia, your namesake mentioned about endometriosis. So this is abnormal tissue growth within your uterus lining, and it's basically your body just not being comfortable with that. Osteopathy doesn't help directly with endometriosis, but it can help with just easing the pain through doing something what we call visceral osteopathy. So working directly on the uterus, working on the blood supply to that area, working on the lower back, which stimulates that part of the region to ensure that it's not overstimulated or understimulated. Again, giving dietary advice, working on the liver, because liver produces the hormones that will contribute to how endometriosis reacts at the production of all sorts of reproductive hormones. So directly, osteopathy will not be able to help endometriosis, but through working on the liver, stimulating good liver health, working on the nervous system, we can help manage and reduce the effects of endometriosis.
Right. Everyone's looking for a cure for endometriosis. It's become the biggest nightmare.
And
I
think
to ask about. Sorry.
I think the food that we eat has a lot to play with it. I think a lot of the food that we eat have so many chemicals in it, and so a lot of the food is processed that our bodies are not able to break it down, and there's an overstimulation of certain hormones and all that. So eat what's local and seasoned and local to your area, and try eat fresh food is what I would say.
Yeah, that's good advice. I wanted to ask about, do you have babies as patients? Do they come to you as children?
So I personally do not treat babies up till the age of 5, but osteopathy and pediatrics is huge. A lot of babies will need some kind of manual therapy. So let me give you an example. It's a bit scary, but please don't be disheartened. But a lot of the times, babies need to be forced out because either the mom's too tired and can't push enough, or there's a breech pregnancy.
Yeah.
A lot of this is trauma to the baby. So now imagine a baby's head. It's so soft and pliable. It's almost like Play-Doh. Please do not squish your baby's head to test it out. But when the baby is not coming out naturally because the mom's unable to push, they use forceps to help the baby's head come out. Now, forceps is putting pressure to the head here. There's a lot of compressive, unnatural forces that go through to the baby's head. Breech baby, you're pulling the legs, the neck can get yanked. You get neck injuries, head injuries. Stressful pregnancy, the baby is not coming out, the heart rate drops, the mother's heart rate drops, and the emergencies. So a lot of emotional stress happens during pregnancy potentially. Unused forces going to the baby. Now, this can lead to potential complications to the child. So head formation doesn't happen smoothly. So cranial osteopathy can help rebalance and unload the tension in the baby. Because of the complications in delivery, there's misbalance between the muscle tensions, so they're unable to latch onto the mother's breast to feed. Because of the trauma, the lungs may not be fully opened up. Yes, according to the APGAR score and the doctors, they'll say, oh, the baby's healthy because they're crying and all that. But the ability to draw in air and out, sucking requires a lot of force and musculature in the jaw and the throat. Now, if there's imbalance, the baby will not be able to feed properly. Yes, they'll cry, they'll breathe, but in terms of sucking, it's a very specific skill set. So a lot of the times, the mothers will panic, oh, it's me, my baby doesn't like my milk, or the baby's not latching onto me, it's me. Sometimes it's the baby who's not able to get the head in that position and suckle. So seeing a cranial osteopath will help rebalance that, restore some kind of normal tension to it. Working on the pressures of the head, there's a lot of fluid that's built up in the head causing restlessness in the baby, colic. Colic is again imbalance within the gut and the digestive system. All these can be as a result of a traumatic birth.
¿Qué por cuánto, Pavel?
So a lot of it can be helped with cranial osteopathy.
Wow. Let me ask you a quick one. Between occupational therapy and osteopathy for babies, what's the difference? When should one go to an occupational therapist in terms of maybe neck pain for the baby? Guys, I don't know if you've ever seen a baby who's leaning one side, just a little bit. It's just a small lean. When that happens, who do we go to?
Wow. Occupational therapists, physiotherapists, osteopaths, chiropractors all work hand in hand. Occupational therapists and osteos will work hand in hand. When should one see an occupational therapist versus an osteopath? Difficult to answer. I personally have never seen an occupational therapist work solely alone. They've always hired a physiotherapist and osteopath working alongside them. So I wouldn't know exactly how to answer that. Sorry.
Okay.
Occupational therapists are very good at what they do and help people with neurological impairments, restoring function, and all that. So I guess again, sorry, I wouldn't be able to answer that.
No worries, no worries. Guys, if you're still here, I need you to give me a wave or a thumbs up because I have a surprise for you all. So just let me know if you're here. If you're here, just go on your chat function and just look for it and just give me a wave or a hand and just let me know that you're here so that I can see you before I give out my surprise. I see CK is here. Where are you guys? Let me see your hands. Maya, thank you. Manuela, I see you. I see you guys. I see you. Sylvia, I see you. All right. So I just want to, Mihir, where are you? Where are you located? If I wanted to find you, where do I find you?
Sarit Center. I'm in Sarit Center.
All right. Where in Sarit Center? Should I just go in and ask for Mihir?
So I'm in the old wing of Sarit Center on the second floor. My clinic is called Pain Matters Consultancy. The food court is right next to my office, so you guys can have a nice lunch and come, or you can have treatment and have lunch as well. So you can make a day out of it.
Super duper. I really appreciate you coming here, and I'm just really happy. Guys, I have a very quick trivia for you all. Mihir said there's one specific pain that is very common. And the first person, I want 3 people, okay? I want 3 people, 3 mothers. I want you to tell me which pain this is that is very common. Just write it in the chat function. And the first person to write it, the first 3 people, I'm giving away gift vouchers. So write, which is the most common pain that I see answers coming in. I'm giving away gift vouchers, right? So tell me, Mihir said there's a common pain. There's a common pain that is throughout, there's a lot of money. I'm just giving you tips. There's a lot of money that is, all right. So I see Maya, good job. I see Ida, and I see Shira, and my vouchers are done. Thank you so much. Sarit Center has given us vouchers to write out. And I have the first 3 people to write down which pain. It is the back pain. Back pain is the most common pain that we have. If you haven't one, don't feel bad. Just join us next week and we'll probably have something else to give you. Maya, Ida, Shiro, please reach out to me after this call. Just WhatsApp me or text me or let's talk. Don't leave the Zoom. And I'm just so happy to have Mihir here. If you need to reach out to Mihir, I'm going to send all his details on the platform. So just look out for that. If you're not on any of our platforms and you want to join us now, stay back so that I can share with you one of our WhatsApp groups. But remember, we're on social media everywhere. We're on Instagram with the Queendom KE. We are on WhatsApp. We're on Facebook. We're on YouTube. And this is going to go live on as well. So I'm just so happy that you guys are here. And
Can I leave you with one last piece of
please do.
advice or suggestion?
Please do.
Ladies, if you are weight training, please do not stop during pregnancy. If you're working out, do not stop during pregnancy unless you have been specifically told that it will be harmful to your baby. 99% of the time, you are safe. Working out will promote endorphins, release of endorphins, which is again a chemical that promotes good well-being and positive energy in yourself, which will minimize the chances of you getting postnatal depression. Please work out, get some fresh air. We do not want you to be bed rest and suffer consequences as a result of bad advice. And if you're struggling post-pregnancy or even during pregnancy, please seek help. There is no shame, and we live in a world where people do put undue pressure on us. Speak out, seek help, don't suffer in silence. Love thyself like you love the world.
Wow. That's all I needed. That's all I needed to hear. Sometimes mothers just need to hear it. He's mentioned so many times that we do everything for our children, but we don't do enough for ourselves. And even in the airline, they tell you first to mask up. If you're not secure, if you're not masked up, you can't save anyone. So I just want, if you are stuck, struggling, confused, remember to reach out to the Queendom. We are always here for you, and we have all the consultants at your disposal. So please reach out and just tell us you're looking for an osteopath, and we'll quickly direct you where you need to go. I really appreciate that you guys are all here. You've stayed in for the longest time. For mothers, this is like critical time, so I'm going to try and let you guys go. But I appreciate you. Thank you so much for having this session with us. And remember, every Wednesday at 7 p.m. we are here. So just find us on socials. The link is the same link, and we're just going to get you back on the platform. I really appreciate you, Dr. Mihir. Thank you so much. I still feel like you're a doctor, but Mihir, thank you so much for the honor that you've given us to have you on this platform. And to Sarit Center.
Thank you for having me. And if there's anything else I can help with, please do let me know.
Sure thing, we'll do. We'll reach out to you and we'll keep you connected onto the Queendom. I appreciate you guys. Thank you so much. And I do want to release you to have a lovely evening and a lovely week. Asante, and see you soon.